Now, this part of the chapter talks about the endocrine response to stress. So what are the stress hormones? What are the effect of these hormones on the body? Now, what is stress? So a broader meaning of stress is a real or perceived threat to homeostasis. So that threat might not even be real. It could be a perceived threat. And the body is going to respond to that threat, going into stress mode. These threats could be, it's a wide range of different situations. So it could be physical trauma. It could be prolonged exposure to extremes of temperature. Maybe just things that are considered normal, like pregnancy, for example. That is considered that's considered a type of stress that the body would have to respond to. Of course, emotional stress, sleep deprivation, infections, all of these are considered stressors that the body would respond to in different ways. The endocrine system responds to stress by changing the levels of hormones. So it'll increase cortisol secretion from the adrenal cortex and increase epinephrine secretion from the adrenal medulla. Now, as you guys know, that cortisol, so the next couple of slides kind of discusses the role of cortisol in stress. And cortisol is the chronic stress hormone, while epinephrine is considered the hormone of acute stress. So if a person is under chronic stress, their bodies will be exposed to higher cortisol levels, and cortisol permits the action of epinephrine and norepinephrine on the smooth muscles of the blood vessels. So you can see how chronic stress could eventually lead to hypertension, because cortisol levels increases the actions of epinephrine and norepinephrine on the smooth muscles of blood vessels, leading to their constriction for longer periods of time. So again, chronic stress can eventually lead to high blood pressure. Chronic stress can also lead to low immunity, and that is because the high cortisol levels decreases capillary permeability and the production of prostaglandins. So cortisol delays the inflammatory response. We actually use cortisol as an anti-inflammatory. It can also maintain the concentration of metabolic enzymes required to produce glucose in between meals. So cortisol, again, on the long run, chronic stress, chronic high levels of cortisol can lead to diabetes, because the enzymes that are responsible for decreasing glucose levels in the bloodstream would be affected by these high cortisol levels. And cortisol is also responsible for proper fetal development. So you can see that chronic stress in a pregnant woman can lead to abnormal fetal development to that in utero. Now, what are the effects of increased plasma cortisol concentration during stress? So these are more effects. If we're talking about the effects on organic metabolism, it can stimulate protein catabolism. So basically high cortisol levels, would lead to the breakdown of proteins. So protein catabolism. So we are talking about the breakdown of bones that could lead to osteoporosis, breakdown of muscles leading to muscle weakness, and so on. It will do everything possible to increase the level of glucose in blood. So what cortisol does is that now that it knows that the body is in a stressful condition, it translates that into that the body now needs lots of glucose to burn in order to deal with that stress. And it will do anything possible to make sure that the body always is in a constant condition of hyperglycemia. And that again is why if you go through chronic stress with high cortisol levels for a long period of time, these individuals can eventually become diabetic. So what are the ways that cortisol makes sure that the patient or that this person has hyperglycemia? Well, first off, we already said that it will keep the glucose in blood. Okay, so it decreases insulin levels. It actually increases glucagon levels. And when we talk about the action of insulin and glucagon, you will understand how that would eventually lead to hyperglycemia. It also increases what is known as gluconeogenesis. Gluconeogenesis is a process that happens in the liver where the liver is going to make new glucose out of amino acids. So remember, cortisol broke down proteins, okay? It's breaking down bone and muscle and so on. It'll take those amino acids, the liver takes those amino acids and changes them into glucose. And again, we call that process gluconeogenesis, or the generation or the creation, the genesis or the creation of new glucose. Okay? And again, in order to maintain high plasma glucose concentrations, it will also break down adipose tissue. It will break down fat tissue. Okay, and that is why, again, chronic stress can lead to loss of weight, because we are always breaking down that adipose tissue, breaking down triglycerides into those 3 fatty acid chains and glycerol. Remember, we said that cortisol is going to, which we were talking about in the previous slide, it will permit the action of epinephrine and norepinephrine on the blood vessels. Okay, so it'll increase the effect of epinephrine and norepinephrine on the smooth of our blood vessels, leading to vasoconstriction. So again, chronic stress can eventually lead to hypertension. It will decrease our immune system. So again, chronic stress can lead to recurrent infections. Okay, due to also inhibition of the inflammatory response. It will inhibit non-essential functions. So cortisol or chronic stress, the body is now dealing with something that is chronically stressful to the body, and the body decides to shut down other things that are considered non-essential at the time. So for example, reproduction and growth. So if a person is under chronic stress, that can lead to hypoproduction of sperms in males, or it can lead to menstrual abnormalities in females. If a kid has chronic stress, let's say they've got a chronic health condition that they're dealing with, and because of that, they have high cortisol levels for a long period of time, and they are going to be, they have what is known as stunted growth, where their growth doesn't match the kids that are of their same age group. They can catch up later once that chronic stress is gone, but for a period of time, there will be inhibition of what are considered non-essential functions, for instance, again, reproduction and growth. So that's for, the function of cortisol, or the effect of the relationship between stress and cortisol. And now you understand what it does to the body and why chronic stress can lead to hypertension and diabetes and recurrent infections. And you want to make sure that you're comfortable with the explanations. Okay. Now, adrenal insufficiency, that would mean where there is low levels of cortisol. Okay, so insufficiency means that there's not enough cortisol coming from the adrenal cortex. So patients that have adrenal insufficiency have a wide range of symptoms depending on, the severity of the severity of the disease, the cause of the disease. Generally speaking, they would have fatigue and weakness, loss of appetite, and loss of weight. Okay, and due to the low cortisol levels, okay, they would have low blood pressure. Remember again, that is because of the cortisol permitting the effect of epinephrine. Now that these individuals have low cortisol levels, we have lost that permitting effect. So they would have hypotension, they would have hypoglycemia. Again, you're kind of reversing all of the effects of cortisol. Now, primary adrenal insufficiency means that the insufficiency is due to a cause in the adrenal cortex. That's what primary would mean. A secondary adrenal insufficiency would mean that the cause of the insufficiency would be due to something wrong in the anterior pituitary. So the most common kind we have are these primary adrenal insufficiencies, where again, the lesion or the pathology is in the adrenal cortex itself. And that is known as Addison's disease. So there's a loss of the adrenal cortical function, and it could be for, again, wide range of causes. It could be due to an infection like tuberculosis. Tuberculosis is a pulmonary infection. It usually happens in the lungs, but then it can spread to other parts of the body, including the adrenal cortex. Okay, and if it does, it will destroy the adrenal cortex. So now this person will no longer be able to make cortisol. Or another cause of Addison's disease besides tuberculosis could be that the adrenal cortex is destroyed maybe by an invasive tumor, so maybe a metastatic tumor. By far, though, the most common cause of Addison's is an autoimmune disease, where, again, the body makes autoantibodies against their own adrenal cortex, destroying the cells that make cortisol. In Addison's disease, sometimes not only are we destroying the part that makes cortisol, but we are all destroying all three layers of the adrenal cortex. So now we're not making cortisol, we're also not making aldosterone. Okay, so in that patient, that would be a little bit different. So you have all of the signs of low cortisol levels plus signs and symptoms of low aldosterone levels. So there would be an imbalance in the sodium and potassium ions, also an imbalance or abnormality in water homeostasis. And that again, because aldosterone is an actually important regulator in sodium and potassium and water blood levels. The loss of salt and water balance can lead to hypotension. So you can see here, this is kind of, gives you an idea about Addison's disease and what that patient would come with. So they would have hypoglycemia, loss of weight, muscle weakness. They have the hypotension known as a postural hypotension. So they're fine when they're sitting, but when they stand up, they feel dizzy. So they get this hypotension due to change in their posture. And other manifestations, the ones that are important again are your hypotension, hypoglycemia, loss of weight, and muscle weakness. And you want to make sure you understand why these are occurring, mainly due to the imbalances in the ions, sodium and potassium, and due to the loss of water balance as well. Now, Cushing syndrome is the opposite. So Addison's disease was adrenal insufficiency. So we're not making enough hormones. Cushing syndrome is the opposite. This is an excess cortisol in the blood. So the adrenal cortex is just making too much cortisol. Know that this is in a non-stressed individual. So under stress, normally a person would be making high levels of cortisol. So that would be normal. But in Cushing syndrome, this individual is not stressed, but their adrenal cortex is still making too much cortisol. Again, it could be primary or secondary. So again, primary means that the defect or the pathology is in the adrenal cortex itself. For example, maybe there is a cortisol secreting tumor in the adrenal cortex, or it could be secondary where there is a tumor in the anterior pituitary that is making too much ACTH. In Cushing's disease, in secondary Cushing's, the increased blood levels of cortisol would start to break down bones, so uncontrolled catabolism of bone. So again, these patients would have osteoporosis due to that. Uncontrolled breakdown of muscle, so they would have muscle weakness. Uncontrolled breakdown of the skin, so they would have what looks like stretch marks all over their skin. And the other organs, so they find breakdown of the blood vessels, so they've got easy bleeding tendencies and so on. So these are the problems that occur in Cushing. So osteoporosis due to the breakdown of bone, muscle weakness due to the breakdown or the catabolism of proteins, thin, easily bruised skin. Again, we're breaking down the protein of the skin. Blood sugar levels increase, and we already understand why high cortisol levels would do that. Again, putting your body or making sure your body has enough glucose to deal with quote-unquote stress that it's going through. Again, Cushing syndrome, they would have immunosuppression because of those high levels of cortisol that inhibits the inflammatory process and inhibits prostaglandin synthesis. Very characteristic that it would have this redistribution of fat. So the fat of the body is going to be redistributed in a way where they have what is known as a buffalo hump and a moon face, and I'll show you what those are in the next slide. They would also have hypertension. So remember, again, cortisol kind of has that effect where it permits the action of epi and norepinephrine on the smooth muscles of your blood vessels, leading to eventually hypertension. In order to treat Cushing syndrome, it really depends on what is causing it. So if it is a primary Cushing syndrome due to a tumor in the adrenal cortex, so you can perform an adrenalectomy. But if it is due to a tumor in the pituitary making too much ACTH, then we could surgically remove that pituitary tumor. Here you can see the what we were talking about, the very characteristic for Cushing syndrome. So the moon face, where they have the puffy cheeks and the redness on the cheeks. Right here you can see all of these stretch marks due to the breakdown of the skin protein. And then you can see here the redistribution of fat, and that is known as the buffalo hump. What are the other hormones that are released during stress? So obviously cortisol and cortisol and epi/norepinephrine are huge when it comes to stress, but there are other hormones as well that play a role in this. So vasopressin and aldosterone, okay, both of these eventually lead to high blood pressure as well. Okay, so vasopressin, which is the old name for antidiuretic hormone, it presses the blood vessels. That's where the name comes from, leading to vasoconstriction of the blood vessels. And aldosterone is going to lead to salt and water retention. So it'll retain water and sodium in the body while it dumps potassium into the urine. So these two are also help in the increase of blood pressure. So why do we have these hormones? If everything eventually leads to high blood pressure, why do we even need them? Well, if a patient is dehydrated, okay, or has severe hemorrhage and their blood pressure is going down really fast, a way for the body to deal with this would be to increase the production of vasopressin and aldosterone in order to keep the salt and water in the body, constrict the blood vessels in an attempt to keep the blood pressure within normal. Okay, so we do need these hormones sometimes if there is a potential risk of severe low blood pressure due to dehydration or hemorrhage. Okay, hormones also has effects on growth hormone, glucagon, and insulin. So stress would lead to the decrease in growth hormone, and we've seen that where we talked about how stress will lead to the temporary stopping of what we call non-essential functions of the body, like growth. So it'll decrease. So stress again decreases growth hormone. Stress again also decreases insulin and increases glucagon. And that again eventually would lead to high glucose levels in your blood, leading to hyperglycemia and maybe diabetes. Stress increases beta endorphins, and that is related to its pain-killing effects. So if somebody is, let's say, in acute stress, okay, and that leads to increase again in the beta endorphins. Beta endorphin is a mood enhancer that decreases our sense of pain, which is a good thing when we're in stress because you want to deal with this bigger stressor as opposed to those smaller pains that are happening at the same time. So a chronic stress or acute stress will increase beta endorphins, and we can use that to decrease the sense of pain from other things that are not as important at the time. While stress will increase the secretions of epi and norepinephrine. So again, just to kind of wrap up the hormonal effects of stress, stress increases cortisol, increases epi and norepinephrine, increases vasopressin and aldosterone, increases glucagon, increases beta endorphins, it decreases growth hormone and insulin. Now, other effects, generally speaking, due to all of these hormonal changes, what is going to happen in the body because of that? Well, remember we already said that chronic stress can lead to diabetes because of the high glucose levels. The body, not only does the liver make glucose out of amino acids, a process that we call gluconeogenesis, but it also breaks down the storage of glycogen. We store glycogen in the liver, in our skeletal muscles. Well, we are going to start breaking down that glycogen in a process called glycogenolysis. So again, providing more glucose in our bloodstream. We will break down the adipose tissue, and the triglycerides will break that down into 3 fatty acid chains and a glycerol. We will make gluconeogenesis from these fatty acids. Increase the cardiac function. So these patients or individuals under chronic stress could have tachycardia and high blood pressure. The body will also divert the blood from what are considered at the point non-important viscera, like, say, the intestines and the stomach, to the skeletal muscles. Okay, so it will constrict the blood vessels of the viscera and dilate the blood vessels of, say, the brain and the skeletal muscles to kind of deal with that stress that's happening. And of course, this can be reversed later on. It'll also increase lung ventilation by stimulating the brain centers and dilating the airways. So this is the end of the hormonal effects or the hormonal changes due to stress, and I will see you in the next phase.